So funny story, we were sitting by the pool drinking Prosecco, and we all have a passion about securement and
Prosecco.
And Prosecco. So we thought, what a brilliant idea, bring it all together.
We've put a lot of time and energy in placing the device that we need in for our patients. We need to optimize their securement and keeping them there for the life of the line, whether that be days, whether that be weeks, whether that be years.
There was always a prioritization for insertion technique and getting the line in, choosing the device, etc. And we, the three of us, in the work that we do daily and, what we contribute to the science and the specialty, we really want to keep these lines in. And we and the international flair of it is really, I'm from Canada, Mark's from the States, and the Aussie, the Aussie contingent. We really want to, demonstrate that it's just not happening in your little
Bubble.
There's lots of bubbles.
Plenty of bubbles.
Plenty of bubbles.
And plenty of bubbles in Prosecco, too.
Very bubbly.
My focus was in the very beginning focusing on collapses. And in our data, we found that with reviewing almost 8,000 PICs, that the risk for infection in a collapse-related diagnosis was 288% greater using an adhesive device versus a subcutaneous securement.
So the other thing with PROSECCO and our talk is we go through the evolution of securement, how we got to a subcutaneous anchor securement device, where look what we started with, and the outcomes weren't that great, and now what that looks like today, which really I think is positive, and we can look towards the future. We also talk about the dressings, and how to keep the dressing in place.
And I think also recognising that not one securement product will always fit your every need. So like Jocelyn was saying, you need to make sure your dressing stays in place. So you might not come across issue with all of your patients, but particularly for some cohorts, you find it difficult to get anything to stick to them. Mm-hmm. Having some kind of adhesive adjunct that you can add to your dressing to make it more tacky, that's going to improve the securement.
And the last time we did this talk, I think it just came out inadvertently, but I made the comment that if you have one thing in your toolbox, you don't have a toolbox. You have a box with one thing in it.
Yes.
So if you're truly trying to put together a toolbox, you have to meet the needs of that different patient, of that different approach to having a good outcome. And do your due diligence.
Mm-hmm.
Don't just take the possibility that someone handed you a paper or something that only focuses on one aspect of securement or one aspect of an outcome. Do your own due diligence. Talk to your cohorts in crime from different areas of the country that are dealing with this themselves and find out what's working for you. How are you using it? I've tried and this happens, and how did you solve this problem? Because that's where we actually use that toolbox effectively.
Ultimately, you want the best products and you want them at your fingertips. So always make sure you've got your full complement of tools, so that you can provide the best care and the best securement, in this case, for your patients.